Well, good afternoon. Thanks again for joining us for today's Daily Update. I'm Dougal Saunders, joined by Chief Executive of the Western New South Wales Local Health District, Scott McLaughlin, and also today Dan Robinson, who's been running a very special part of the operation here in Dubbo, the COVID Logistics Hub, which is just near, literally running out of the back of the Dubbo Regional Theatre and Convention Centre. And Dan's here to tell us a little bit about what that operation has been like. And the amazing support that he and the crew has had from not just local businesses, but businesses right across the state. So really looking forward to hearing from Dan today. Now, up until 8 o'clock last night, we have 15 new cases across the Western New South Wales Local Health District. 7 of those are in Dubbo, 3 in Wellington, 1 for Narromine, 1 for Bourke, 1 for Bathurst, 1 for Orange, and 1 for Blaney. Now, on that Blaney case, just to note that will not affect Blaney going back into lockdown. That is a case that's confirmed as not being in the community, and Scott can talk a bit more about that one and also maybe about the Narromine case. But total of 15 for the Health District, which takes the cumulative total now to 1,039. Dubbo with 745 of those. And for the Far West today, Wilcannia 3 new cases, and Broken Hill 2 new cases. Now, unfortunately, today we have to report 3 deaths at aged care facilities in Dubbo. A woman in her 80s at Holy Spirit, a woman in her 90s at St Mary's, and a man in his 80s at St Mary's. Scott will again provide a little bit more detail, but at this time, obviously, our thoughts and sincerest condolences to the family and friends of those people. This is a really difficult time, and we do understand how difficult it must be given the situation we're in. 334 people have been looked after at the moment, currently in the COVID Care in the Community program, which continues to work really, really well. An extra 34 people discharged in the past 24 hours, so no longer infectious and no longer requiring any of that ongoing care. That's over 600 now, which is great. From the 15 new cases, 2 that we know of have definitely been infectious in the community for more than 2 days in Dubbo. 7 have been isolating. 6 are being investigated, and Scott can talk a bit more about the other links and any sewage detection as well. Just a reminder, I did mention this yesterday, but there are still some parts of social media that seem to be trying to convince people you don't need to wear a mask anymore. Let me just remind you again, you absolutely do. Masks are mandated anytime you leave your house, apart from the obvious exemptions that are available. Health orders are amended all the time. There was a specific order around masks, which has now been absorbed into the overall public health orders. So anyone suggesting that masks do not need to be worn on any part of social media is completely incorrect, and part of what you can do is actually reinforce the message for our entire community that masks are still very much a part of the plan that we are under at the moment. Testing across the district still not amazing, 1,900, 900 of those in Dubbo, so across the entire rest of the district, only 1,000 tests, which is not great. But part of the change we see now in a lot of our region is around surveillance testing, which is a really good opportunity to try and get a little bit ahead of things. So we know there's surveillance testing happening now at Walgett, Trangie, Lightning Ridge, Cowra, Nyngan, Forbes, and also Mudgee, and that's due to concerns around sewage detection. Scott will talk a little bit more about that, but Dubbo, Bathurst and Bourke underway with surveillance testing as of today, just due to the large amounts of community transmission, and Brewarrina cases there, but still no indication really as to how the cases got into the community. So if you are in any of those areas that I've mentioned, testing is available, surveillance testing is available, and what that means is you can go and get a test. You do not need to isolate after you've received the test if you have no symptoms, if you have no concern. So if you haven't been to a venue of concern, if you haven't been with somebody who's been to a venue of concern or is a confirmed case, you don't need to isolate. So it's an opportunity to get tested, keep working. When you're doing that, you still need to do the right thing. That requires the mask, it requires the distancing, it requires hand hygiene and making sure you're following all the things you need to do while you're working. On to vaccination, and gee, it's been such a fantastic week again right across our region, including at the Dubbo ADF clinic, which is still operating at the Dubbo Regional Theatre and Convention Centre for second doses. Those second dose clinics running through until Sunday. All of that will be a booking for you. If you've received a text message, you'll know what day to turn up and what time frame to turn up as well. If you haven't received that, as we've been saying, go on the corresponding day to when you got your first jab. So that runs until Sunday. This weekend as well, though, we're providing a real opportunity for HSC students in particular will be given priority for first doses. So there's a bit of extra availability there. If you're an HSC student or have students that are doing the HSC, Dubbo on Saturday and Sunday, there will be priority given to HSC students for first doses, and really anyone above that 12-year age group, 12 to 15, that wants to come and try. This will be limited availability, but we're really prioritising HSC students. And again, Scott will have a bit more detail about that. Schools have been contacted, so hopefully that message is getting out there around prioritising our really important HSC students for this year. Now, second dose clinics are also happening at Warren. That continues today. Peak Hill is happening today. Trangie and Forbes start theirs tomorrow. At Narromine, second dosing starts on Sunday, and again, that's for bookings that have received a text message. That's happening at the Sports and Fitness Centre. There's also some opportunities there for some first doses as well. So for Narromine and Trangie teachers, for students over 12 and their families, a great opportunity to get some first dosing if you haven't had an opportunity up to this point. And there's also at the Narromine Keeping Place an opportunity, again, with a walk-in clinic, first or second doses, particularly welcoming and giving real encouragement to all of our Aboriginal members of the community to come forward to the Narromine Keeping Place right across the weekend. No appointments needed, 10 till 5, and try and be part of the vaccination as we move forward towards that 70% double-dosed mark. Mudgee starts on Monday. That'll be happening at St Matthews. There was a little bit of confusion around where that second dosing will happen. Definitely St Matthews. And there is a link on this post to all of the details around the Vax clinics when they're in your part of the region and when that second dosing starts. So when you're looking at this post, you're watching this video, if you go to the top, there's a little section that says see more. If you click on that, it will unfold all of the information. There's a lot of information there, including lots and lots of links, but helpful ways of navigating what we're talking about. So please make sure you do that. The other clinics that are still happening as well, and I mentioned yesterday, Westhaven is running its own clinic in conjunction with Aspen Medical, and that's Monday to Thursday next week at Westhaven. That's for people living with a disability, disability workers and volunteers, people experiencing homelessness or living in emergency accommodation, also for people who identify as Aboriginal, and also for essential workers. There's a link on our post here today on how you can make a booking. So again, lots more opportunities to get a booking in a lot of different ways at the moment. Wellington continues second doses, and today's basically another fantastic opportunity for people that have received that booking, and AstraZeneca is still happening at Wax and at Swift Street Medical. Mudgee, as I've mentioned before as well, this coming weekend, a big weekend for students over 12. So for students right across the Mid-Western Regional Council area, that Vax clinic is happening for this weekend. Bookings at the Vax clinic 6362 4031. And of course, we've still got our GP clinics, our respiratory clinics, our pharmacies. Take the opportunity. There are so many bookings available. Don't just think about one thing only. Think about all of the different options we have across our region. With that, I'll hand over to Scott for his health update.
Thanks, Dougal. Well, a really upsetting day in Western New South Wales, particularly in Dubbo and in our aged care facilities, with 3 residents that have passed away in the last 24 hours. That brings our total to 7 deaths across Western New South Wales now out of this current outbreak. So the 3 residents out of both Holy Spirit and St Mary's aged care facilities. 2 in St Mary's aged care facility, 1 woman in her 90s, fully vaccinated, 1 Aboriginal man in his 80s who's had 1 dose of vaccine. In Holy Spirit, a woman in her 80s who was fully vaccinated. Now, our sincere thoughts and condolences go to the families, to friends and loved ones of these residents, but also to the people that are working so hard in both aged care facilities to try and halt the spread of COVID-19 and stop us seeing further terrible outcomes like this. So with such a sad day in Western New South Wales, I think it's a really timely reminder that COVID doesn't discriminate where it travels. It doesn't know the boundaries of local government areas. It doesn't know the boundaries of households, of shopping centres, of the places we visit every day of the week. We know that it's highly contagious. It's spreading at a rate that we haven't seen before. We know that there's been people in our communities in recent days who have been infectious. We know that the movement between our communities means any of our region, any day of the week could be the next case. Now, with over 280,000 people in our region, we saw less than 2,000 tests in the last 24 hours. That's one of the most concerning things for us, not to know where COVID is circulating around our communities. Please, can I implore everyone, go and get a test if you've got any signs and symptoms, however mild. Too many people are picking up COVID-19 and having days before it's being diagnosed. We're expanding further the surveillance testing, and we'll come back early next week with further information around how that can help add to our arsenal to stop COVID in our region. But the stark reminder is today, with local government areas, we know it's going to keep continuing to spread. We know it'll keep making people sick. I know we're all sick of this, that some people are getting very sick, and we're seeing the terrible outcomes of that at the moment. There's a lot of focus on when local government areas will come out of the lockdown. But at the moment, we've still got 350 patients or people with COVID in the care of our community teams. Now, those patients are being very well cared for, but again, a reminder that there's 350 people in Western New South Wales that are crook with COVID in our community. So with that, to 8 p.m. yesterday, there was 15 new cases identified, quite a number more overnight, that the numbers will continue to rise in coming days. Out of those 15 cases, 7 were in Dubbo, 3 in Wellington, 1 in Bathurst, who's a household contact, 1 in Burke, who's a household contact, 1 in Orange, who's a household contact, 1 in Narromine that we're retesting at the moment. There's a chance it may be a false positive in the test. And 1 identified in Blaney that we know hasn't been infectious in the community in Blaney that picked up COVID-19 actually in Sydney at a medical appointment. So out of those 15 cases, we've now got links to 8 of those cases, 6 of those household contacts, and 2 are linked to known clusters or cases. 7 are still under investigation. We know that at least 3 of those 15 were infectious in the community, and 6 weren't infectious in the community from those household contacts. Again, a growing number of people over the age of 70 with COVID-19, with 50 people over the age of 70 in our community. So to come back to the aged care facilities in Dubbo, 21 confirmed cases in total in St Mary's. 1 new case has been identified to 8 p.m. yesterday in St Mary's. In Holy Spirit, we're seeing a real stabilisation in Holy Spirit with no new cases to 8 p.m, but again 17 confirmed cases in that aged care facility. Again, more venues of concern have been loaded, particularly in Dubbo, so if I can ask everyone in Dubbo to please look at the New South Wales Health website, familiarise yourself with this on a daily basis. If you've been at the venues of concern that have been flagged, some of them might be up to a week ago, and so please think about where you've been. If you have been at any of these venues, then please come and get tested. Again, Dubbo, we've got surveillance testing available for people that don't have symptoms, and so if you don't have symptoms, please come and get tested. Only having to isolate if you've got any symptoms. A new sewage test again in a location we don't have any active cases at the moment in Nyngan. Now that's a number of times now we've had sewage tests go off in Nyngan. That's got a significant flag for us that there is someone in the community with COVID-19. So we're opening up surveillance testing in Nyngan over the weekend. So please, everyone, come forward and get tested, even if you don't have symptoms. It'll be a phone forward to the multi-purpose service for testing. Again, around 2,000 tests in the last 24 hours. That was significantly down on what we had a week and 2 weeks ago, when we know we had around the same amount of cases being identified, people infectious in the community, and so the risk hasn't changed. We know that there's still a significant risk of people picking up COVID on the streets, in the homes and in supermarkets and shopping centres. Surveillance testing, again, throughout the weekend, available at Trangie, Lightning Ridge, Cowra, Forbes and Mudgee. Bathurst, Dubbo and Burke are now expanded to Nyngan as well. And so people in those communities, please come and get tested, even if you don't have symptoms. If you do have symptoms, please don't leave the house without coming to get tested first. The mobile at-home testing is still available across Dubbo, Orange and Bathurst. A phone call through to our call centre will help people come into the home and get you tested to 1300 066 055. Now, that's a service that's available, and we do have capacity in that service to come and test people in their homes where they're not able to leave the home for a whole range of reasons, so please take advantage of that. To the number of patients in our care at the moment, we've got 334 patients in our care in the community team. We saw another 34 discharge from that in the last 24 hours, and so that's a pleasing continuation of people recovering from their COVID infection. 18 patients in hospital, 4 of those are in intensive care and 3 of those ventilated and very sick. Out of the 18 patients, 9 in Dubbo, 6 in Bathurst, 2 in Orange and 1 in Brewarrina. Silence in my phone. For an indication of how important vaccination is for people in our hospitals, some concerning statistics. 80% of those people are not fully vaccinated. 2 people in their 20s and 2 people in their 30s. They're not in intensive care, but they're pretty crook enough to be in hospital. And again, 80% are not vaccinated of the patients in hospital. Out of our patients in intensive care, we've got 2 patients in their 40s and 2 in their 60s. So again, a reminder that this isn't an illness, a virus that just affects old people. With 2 people in their 20s in hospital, it's a real signal to all of us that picking up COVID and spreading COVID to others is a really serious risk to your health and other people's health around you. So please think about your mum and your dad, your brothers, sisters, your husband and wife and your kids in your everyday activities. Don't leave the house without a mask. Don't leave the house without washing your hands, social distancing, checking into facilities with QR codes, and importantly, coming and getting tested. If you've got any signs and symptoms, however mild, please don't leave the house without coming and getting tested. Our healthcare workers, pleasingly, we've seen further healthcare workers returning to work. We're now down to 11 staff in isolation, and so a real boost to our workforce. Our accommodation support, we've started to see people come in and stay in our motorhomes in Burke in particular. Motorhomes are on the way over this weekend through to Walgett for extra accommodation options in Walgett. We'll see those up and active early next week. Dougal talked about the extensive list of opportunities this weekend for vaccination. They're so extensive, it's not funny. In your community, there are options to get a vaccination this weekend or through next week and the week after. Please don't leave your home today without checking in to see what vaccination options are available and making a booking. There's quite a few walk-in clinics available for first dose people right across this weekend and through next week with the ADF clinics. Again, our vaccination hubs through the local health district services are available in Dubbo, Orange and Bathurst. Please look to those for options for vaccination. And importantly, there's a lot of options available for AstraZeneca. We know that it's readily available. It's a high quality and safe vaccine right across Western New South Wales. We're pretty excited to see Moderna vaccine coming into pharmacies right across the whole of the region from next week, and so we'll come back with further updates around that in future days. With some of that sombre news today, I want to leave you with Dan Robinson. Dan's one of the most beautiful, committed people in the health service over the last month and 6 weeks has been looking after some of the most vulnerable people in our community with a lot of the supports to help them in their homes while they're isolating and being cared for with COVID-19. So I'll leave you now with Dan.
Thank you, Scott. I'm Dan Robinson. I'm a service lead for the Dubbo Logistics COVID Centre. Throughout the outbreak, our team has been providing and putting together, delivering care packages out to support our COVID patients in the community, as well as those at-risk close contacts who are isolating. These packages have helped patients and their families get through those isolation periods in their homes, but also in other accommodation, without the need to be worrying about potentially needing to break that isolation to get a hold of the necessities that they need to continue in their normal life. This program has obviously supported the recovery and the isolation, and working very closely with the COVID care and the community teams, but it's also provided just people to feel a little more comfortable in a really tough time, to try and take some things off their plate, and so they can just take their time and look at after their recovery and their isolation. The recipients for this program are identified through our Aboriginal support officers. There's a huge number of those throughout our community, as well as the COVID care and the community team, which I understand there's been a lot said about them. They're doing an incredible job. People were interested in the different packages and what we actually send out, and so I just thought I'll run that through. All of this depends on the individual's needs and also what's been requested from some of the clinicians. Food supplies, pantry staples, things like that, but also fresh fruit and veg and meat and bread and things like that, getting those delivered out to families. Cleaning supplies have been in high demand, things like disinfectant wipes, multi-purpose cleaner, but hand sanitizer. We've had instances where there's a positive case in the family or in the household, and others are trying to, obviously needing to isolate. Hand sanitizer, masks and things like that are pretty important for those guys. Other essential items that families need at all times, things like nappies and formula and baby wipes, sanitary napkins, things like that, getting those out to families is really important. Medications, obviously these are things that we deal with day to day, and being able to pop out to the pharmacy is not something that people in isolation can do or should be doing. So working with our clinicians where they've indicated that symptom relief is required and things like that, we've got a stockpile of that we can provide, things like Ventolin and other medications, or if we've got to pick up medications from pharmacies and things like that, we make sure that those are delivered. The monitoring kits that the COVID care and the community team use, which have got thermometers and blood oxygen monitors, those are being provided to those who are recovering at home or being monitored at home. That helps the clinicians when they're having those discussions to keep good track of where the symptoms are at and how the people are travelling. So since August 13, we've delivered around 1,000 packages, 1,000 deliveries across Dubbo and the surrounding areas, so Narromine, Wellington, Gilgandra, places like that. And so the team are doing an incredible job to really keep up with that volume. Our team is made up of LHD, like local health district staff, as well as some rural fire service staff. They've been working hand in hand to get the packages together and get them out, load them up, and as I said, truck them out to Narromine or Wellington or wherever it needs to go. This team is an incredibly community-focused team that really just wants to respond to COVID the best way they can for their community, and it's really heartening to see the dedication that team has been putting in over these past 6 or so weeks. This is a 7-day a week service, and that has meant a lot of time missing time with family and friends and others. And needing to dedicate that to the community. So it's been great to see that community spirit there. But in saying that, it is an incredibly rewarding team and the experience for us being able to give back and support in a really practical manner, just being able to know that you're supporting them in those practical ways, in the ways that they need to be supported. Did just want to relay that one instance that really stuck with me was when one of our runners had dropped a package of some kids' craft supplies out to them one day, and then a couple of days later they were driving past to deliver another delivery, and seeing the kids on the front veranda playing with those paints and the colouring in, knowing that they were safe and isolating at home was really heartening and really encouraging. So those are the sorts of things that have kept these guys going and kept the drive going over that period. I did just want to finally say that the amazing support that we've got from some local and businesses and organisations, but also from Australia-wide businesses and organisations have been incredible. So the ADF and the New South Wales Police have been assisting us with deliveries. Obviously RFS, which I mentioned, and Resilience New South Wales have been supporting us. Food Bank and Oz Harvest have provided us a lot of support and produce and things like that to get out to our communities. Midwest Foods locally here in Dubbo has given us a lot of support with logistics and delivery and storage and things like that we couldn't do ourselves. We've seen a huge support from the Sydney Children's Hospital. They got in touch with me and the team and just put their hand up to offer what support they could. They've obviously got some great connections with some big companies who want to partner with them, and as a result we've received a lot of support from people like the Starlight Foundation, Good Start Learning, Coles, Woolies, Kimberley-Clark have all put their hand up to help out too, which has been absolutely overwhelming and very, very much appreciated. And even with smaller local communities, groups like the Buninyong School and Community Care Centre, they've been putting packages together for working with other childcare centres to drop off some kids' craft kits and things like that. So that's been really helpful. Finally, the great alliance that we've been able to build with the Uniting Care here in town has meant that not just our work but their work, we can ensure that everyone in the community that needs support is getting supported, and it's clear where they can get that support. Finally, I did just want to thank Dubbo Regional Council for the provision that they've given us as well around logistics and facility support in order for us to provide the service that we're doing. So I thank you to those people who have been kind and caring when they're receiving those calls, when we're dropping things off, and all those people have been helping us and supporting us out. So thank you for that. I was asked to see if there's any questions.
Thanks very much, Dan. If anyone has any questions for Dan, could you please raise your little digital hands now? We'll just give it a second. It appears the answer to that question might be no, so you're off the hook there, Dan.
Not a worry at all.
Thank you very much for that.
Thank you.
If you guys could raise your little hands if you have questions for Dougal now. Molly from the ABC.
Hi, I wanted to just ask about, in terms of lockdown LGAs that are bordered by non-lockdown LGAs. Best example, obviously, here in Orange, we're in lockdown, but the surrounding LGAs of Blaney and Cabonne are not. Is there any clarity in terms of what people in those LGAs should or shouldn't be doing with regards to isolation if they have to come into Orange for work or for shopping or something like that?
Yeah, sure. Thanks, Molly. Look, it's a fairly, not simple, but in some ways straightforward answer. If you live in an out-of-stay-at-home order and you're going into a stay-at-home order area, you have to follow the stay-at-home orders then when you go back home, and vice versa. So if you use the example of you live in Blaney and are working in Orange, that's fine because you're still conducting work, and as long as you're conducting that work in a safe manner, wearing a mask, distancing, etc., but you're in a stay-at-home area. When you go back to Blaney, you need to follow the stay-at-home orders for Orange because essentially you're still in Orange when you're back in Blaney. So the little bits and pieces that come with being in a stay-at-home area transfer to you because you've been in that stay-at-home area. So it means you can't go to the cafe or the pub or whatever because you're working in a stay-at-home area. So in simple terms, if you are at all in a stay-at-home area, that applies to you when you're anywhere else as well.
Thank you.
Thank you, Molly. Ollie from Win News.
Good afternoon, Dougal. I was just wondering, I know that Blaney has not been put back into lockdown because that case was evidently not identified as being high risk, but just wondering whether there's kind of been any conversations happening with local governments or councils or with the state government in relation to implementing some kind of almost like traffic light system that they use in other states where a case might be identified as high risk, medium risk or low risk, just to clarify what happens when cases do pop up in those areas where restrictions are lifted early?
Yeah, sure. And look, I can tell you that the Health District does work with the traffic light system. It's something that they're using to identify those cases. So Scott can talk you through a little bit about what that means. But in again, fairly general terms, we use that to help really navigate where that case has been. And that's part of the contact tracing, the public health team. They relate all that information back. There is then that traffic light system that's used to clarify whether that person is high risk, medium risk, or really no risk at all, or very low risk. In the Blaney case, it's an extremely low risk. Scott can talk a bit more about that, but being at home, there's no risk in the community there. We saw a similar case in Warrumbungle Shire the other day, and we're aware of that situation where we don't want to just snap lock people down again if there isn't really a good reason to. So that would need to be a case where it either has definitely been or a very high chance of being infectious in the community. So that's how things are being looked at, and the Health District, I think, is doing a really good job using that traffic light system already.
Brilliant. Thank you so much.
Thank you, Ollie. I believe that's it for you, Dougal. Thank you very much again.
Thanks, everyone.
And we'll bring Scott forward. Run through one by one. Gary from ABC Western Plains, you can kick us off.
Great, thank you. Hi, Scott. I wanted to start off by asking you about the aged care facilities that have had COVID-19 cases and deaths attached to them. What sort of work is New South Wales Health doing to help Catholic care during these outbreaks?
Sure. So I guess any outbreak in an aged care facility has been really concerning and an absolute priority for us to provide some support. We know that Catholic Healthcare has taken some very quick and immediate steps to help provide extra care and support around any COVID positive patients or residents and staff. That's involved in some cases relocating them to a safe place to care for them in the facility. A lot of our support has been to provide some of the specialist infection control support and knowledge, help us staff understand all of the things that they can do to help keep residents safe, to stop the spread further in the facility. That's involved some additional staffing from our perspective. And we'll continue to provide a lot of those things to make sure that we can stop the spread in these facilities. I've got to say it is really concerning. We know that 3 deaths is way too many in any of our communities. What we also know, though, is there's been 3 people that have recovered from COVID in those aged care facilities. And so the vast majority of people, particularly those that have been double vaccinated, are actually quite well and not struggling significantly with their health issues.
Okay, and just one more. Given the plan to offer vaccines to West Haven to groups including the homeless as well, is there some concerns that COVID may now be spreading in the homeless community of Dubbo as well?
We've definitely had some signs that there's been people sleeping rough and in apartment blocks or in facilities that have had exposure to COVID and some confirmed cases. And so I guess we'd all share the concern that some of the most vulnerable people in our community should be the absolute priority for us to protect and support. And so we're taking some steps to make sure that they're prioritised for vaccination, that there's accommodation support, that there's regular assessments and an understanding of their needs. And so there's a lot being done in Dubbo, particularly at the moment, around the homeless community, in both finding that accommodation, providing clinical care and support, and some of the other wellbeing supports that Diane's just talked about as well.
Yeah, wonderful. Thanks so much.
Thanks, Gary. Taylor from the Daily Liberal.
Hi, Scott. I was just wondering if you'd be able to confirm or deny a COVID-19 case at Dubbo Lord's Hospital?
Certainly hasn't been on my radar, no.
Okay, thank you.
Thanks, Taylor. Ollie from Wynn. Ollie, you there?
So sorry, I have nothing. That's all good. Thank you.
Thank you. Claudia from Prime.
Thank you, Matt, and hi, Scott again. Just in regards to what Dougal was touching before with the stay-at-home orders and the exemptions if you live in another area but travel to a hotspot for work. For example, some people who live in Mullion Creek, if they want to fill up their petrol tank, they'd have to drive to Blaney or Molong if they don't want to follow the stay-at-home orders, instead of driving just a couple minutes down the road to Orange where their closest petrol station is. Is there any way that exemptions can be brought forward for those people just on the border? What's your sort of take on that scenario?
Sure. So I understand there is some reconsideration of some of those instances where people are going to find it difficult not to go into an area that's under stay-at-home orders. There's certainly that consideration being taken today. And I'd hope we'll see some of those instances clarified in the next 24 hours.
Thanks, that's me.
Thanks, Claudia. Let's go to Andrew Fisher from ACM.
Yep, Scott, can you just confirm that there are no ICU beds in the smaller centres like Parks? Oh, I know you're going to open some in Parks and Forbes and Cowra, and the ICU beds are only in Dubbo, Bathurst and Orange at present. And how many ICU beds we actually have and ventilators throughout the Western District?
Sure. So we've got intensive care units across Dubbo, Orange and Bathurst hospitals with preparations and readiness to look after patients with COVID in all three of those facilities. Those are the only facilities that we will have intensive care patients in those. They require a lot of specialist support and typically the ability to ventilate patients in those facilities. Our facilities and hospitals with the ability to look after patients that are acutely unwell and need to be in a hospital across particularly Parks, Narromine and Cobar are well in the preparations for those. We know that there's been patients in Narromine in the last week and being very well cared for in those facilities. Now we've got a good network of hospitals right across the region. We will make sure that patients get to the right place when they need care, and particularly acute or really serious intensive care across the region.
Yep, but if somebody gets seriously ill, is there an intensive care unit bed at the Cowra Hospital or at the Forbes Hospital?
No, there's not. Only in Dubbo, Orange and Bathurst.
Yep. Okay. Just one other thing with the positive sewage result in Cowra. How often is that testing taking place now, and how quickly are the tests returned?
So I believe the Cowra tests are taken every 3 days. This one that was taken was a couple of days ago. They're typically around 48 hours for us to get the results back. So what it absolutely means is there's been someone in the community with COVID. And so please, to the community of Cowra, don't hesitate. Come and get a test. If you don't have symptoms, come and get a test. If you do have symptoms, don't leave the house and go anywhere else. Come and get a test, please. It's one of the most crucial things we can do at the moment to get in front of the potential spread of COVID in Cowra.
Thanks, Andrew. We'll move on to Sam from the Western Advocate.
Hey, Scott. With New South Wales very close to 50% fully vaccinated as of today, does that give you confidence 70% could very well be hit after the ADF clinics roll through Bathurst and Orange again in 2 weeks' time?
Well, I think it's entirely possible. What it relies on, though, is everyone looking for their second dose vaccines. We know that for people that came to the ADF clinics, they will be contacted to come back for their second dose vaccine. But if you've been vaccinated through your general practice, through a pharmacy, through an Aboriginal medical service or some of the vaccination respiratory clinics, then those are the places you need to look for opportunities and bookings to make sure that you get your second dose. It's going to be one of the most crucial things for us. Getting one jab doesn't give you full protection from COVID. Getting 2 jabs is the absolute crucial piece. So please don't hesitate in making sure you've got those bookings.
Lovely. And I guess the other question I've got is obviously in Bathurst in the past few days, the testing levels have been a bit hit and miss, and probably more so a miss, because I noticed testing was down today on yesterday, even though we had 6 positive cases yesterday. So what language would you sort of use to sort of attract people to get tested, even when there's days where we have 0 or 1 new case, for example?
This is the most important thing we can all do, particularly in Bathurst. We know in the last week and 2 weeks there's been a number of people infectious in the community. We've opened up the surveillance testing to make sure that people can come and get a test, whether you've got symptoms or whether you don't. So even if you're feeling okay, but you've got some concerns, you might have been in a location, you might have been near someone that has had some sniffles. If you've got any health concerns, then please come and get a test. The Mount Panorama drive-through testing is readily available all through the weekend. We really do want to see a record number of people tested over the weekend. If you don't have symptoms, you don't have to isolate. And so the most crucial thing is please come and get a test over the weekend.
Thanks, Scott. That's all from me today.
Thanks, Sam. Renee from the Forbes Advocate.
Hi, Scott. Just further to Andrews, did you have the number of ICU beds that we do have, what our capacity is?
So I don't have them with me, but I know that we've done a lot of work over the last 12 months to make sure that we can increase our number of intensive care beds and particularly our ventilated beds right across the whole of the region. We're very comfortable with that at the moment with the number of patients that we've got in intensive care. The forecast over the coming weeks means that we'll still be able to manage all of the patients that we're expecting to come in within our current number of intensive care beds. And so there's some heartening signs there that we've been able to slow the spread of COVID to a degree that we can manage the number of really crook patients coming into hospital. But nonetheless, they're going to be very crook. They're relying on a tube down their throat to help them breathe. They're patients that are on the edge, that they're patients typically that haven't been vaccinated, and people that have got other underlying health conditions in some cases. Now we know that we've got 2 people in their 20s at the moment in hospital, 2 people in their 30s in hospital at the moment. This isn't a virus that discriminates on age or sex or gender or anything else. So please everyone, this is time to take it really seriously. We've seen, sadly, 3 deaths in the last 24 hours that none of us want to see. This is someone's mother and father, auntie and uncle, and the last thing we want to see is more tragic outcomes across our region. We've got to stop the spread of COVID-19 in Western New South Wales.
Thanks, Scott.
Thank you, Renee. Let's go to Oliver from the Campbell Times.
Thanks so much. Hi there, Scott. My first question, you mentioned earlier that there have been a number of positive sewage tests in Nyngan, which is leading you guys to start surveillance testing there over the weekend. If you were concerned about a positive case being in that area, why was the Boganshire let out of lockdown yesterday afternoon?
Well, the trigger for the stay-at-home order consideration is an active case that's been in the community infectious. We really want to track down if there definitely is someone in Nyngan or in some of the surrounding community that is coming into Nyngan on a regular basis. So please, this weekend is the most crucial time. Surveillance testing is in place. You don't have to isolate if you don't have symptoms. So please come and get a test over this weekend.
Great, thanks, Scott. And just as the other one, I was wondering if you might be able to give us a bit of an update on the cumulative total case numbers in the different townships in the region.
Yeah, sure can. So we'll have some information out this afternoon that'll give details down to every local government area. It's suffice to say we've seen a really significant number of people in the last 2 weeks that have now recovered from their COVID journey or have been discharged from our care in the community program. So in the last 2 weeks, 445 people have been discharged from our care in the community program. A couple of significant numbers. I need to make this bigger for my poor old eyes. 303 in Dubbo, 56 in Burke, 21 in Bathurst, 10 in Narromine, 19 in Orange, 8 in Mid-Western Regional, and quite a few other people in some of the smaller rural communities. And so there's some real success there in helping people through their COVID journey. What we've got in terms of active cases or the people definitely receiving care in our community services is a total of 340 people in that program, 25 in Bathurst, 4 in Blaney, 32 in Burke, 228 in Dubbo, 2 in Cabon, 7 in Mid-Western Regional, 9 in Narromine, 11 in Orange, 3 in Parks, 1 in Warrumbungle and 18 in Walgett. Now, those are all the patients that are in care in our specialist community teams providing support while they've got the COVID journey.
Amazing. Thanks so much, Scott. Wasn't expecting that one.
That's right.
Thanks, Oliver. And finally, Riley from the Central Western Daily.
Hey, I just wanted to clarify with the Orange case, because they're a household contact, presumably not in the community, infectious in the community, that won't affect Orange's 14-day sort of non-COVID infectious period?
That's right, but I think that the reality is in the last week and 10 days there's been people infectious in the community in Orange, and so that shouldn't change how people behave or think or act. Please don't leave your home unless you absolutely need to. Don't leave your home without your mask, without washing your hands, making sure you're socially distanced, checking into facilities with QR codes, and just trying to stop the spread of COVID in particularly Orange. Orange, to be honest, is one of our real concerns. We'll look at the surveillance testing for Orange through next week.
Cool, that's all from me.
Thanks, Riley, and thank you, everyone. That's everyone, so we'll call it a day. I'll get the recording out as soon as we possibly can. Thanks again.
Thanks, everyone. Take care.
Thank you.